my name is McKenna. I'm going to be your nurse today. I'm going to wash my hands. Do I have permission to video record you?
Yes.
Thank you. Alright, so today we are going to do a musculoskeletal assessment. I'm just going to start with asking if you have any history of any arthritis, joint pain, muscle issues, bone injuries.
No.
No history of any musculoskeletal issues at all?
No.
Okay. We're going to start with the temporomandibular joint. So I'm going to place my hands on each side of your mouth here. I'm going to have you open your jaw, close your jaw, open again, and then go back and forth with your chin to the left and right. Okay, any pain or clicking when this happens? I also inspected it and it looks normal. And no crepitus as well. I'm going to have you sit up and I'm going to palpate the back of your neck here for your cervical spine. Processes feel normal. It's normal on inspection. Any pain when I press?
No.
Okay, no pain. And then I'm going to have you roll your neck all the way around. Put your chin to the front and then put your head all the way back. Okay, and then touch your left ear to your shoulder. And then touch your right ear to your shoulder. Perfect. Okay. And then I'm just going to have you turn your head against my hand for testing strength. Good. And then I'm going to do it this side. Good. No pain in your neck when you move it?
No.
Okay, perfect. And your strength is normal. And then I'm going to press here. I'm going to have you lift your shoulders against my hands. Good. And then I am going to also palpate your shoulders. Any pain when I palpate?
No.
Okay, and you have good strength in your shoulders as well. And I checked in for inspection, everything looks normal. And then, let's see. Now I'm going to also go down your arms. So squeezing down all the way to your elbows. Inspection looks normal. Any pain in your elbow?
No.
When I press? Okay. So I'm going to have you bend your elbows up like this, and then down. Perfect. And then I'll have you turn your wrists like this, and then back this way. Perfect. I want you to pull your arms up against my hand and bend towards you. Like bend your arms up. There you go. And then push down against. Good. And no pain?
No.
Okay, and you have equal strength. And then I'm going to assess your wrists. So I'm going to inspect. Nothing abnormal. I'm going to palpate your wrists. Then I'm going to have you hold them straight out in front of you. Bend them upward and then downward. Perfect. Come back up. And then I'm going to have you spread your fingers out all the way out and back in. Okay. And then you can push down and then push back up. Perfect. I'm going to have you turn your hands this way and then push in with your fingers. Perfect. And then any pain in your wrists or fingers when I palpate?
No.
It's normal on inspection. Good. And equal strength to both sides. And then we're going to have you stand up right here. And we're going to assess your hips. So face the camera. Like this way, yeah. And I'm going to assess your hips here. Any pain? Normal on inspection. Okay, perfect. It's going to be a little bit more difficult. Let's see. Come this way. Over here. Okay, bend if you can. Move your leg out this way. There you go, and then come back in. Perfect, and then you can use your left leg out and back in. Bend your knee up.
Left leg?
Yeah. And then out and back in. Now your right leg up out, and back in. Okay, any pain at all?
No.
Okay, you can sit back down again. Right there is fine. Okay. Now I'm going to inspect your feet. You can stick your legs out. Okay. So first I'm going to inspect and palpate all the bones and joints, muscles, any pain.
Yeah.
Okay. Lift your feet up and then back down. Then put your toes together. Then your toes apart. Your feet together. And then bottom, like your heel apart. Okay, good. I'm gonna have you push against my hands and then pull up there. Good. There's equal strength. Any pain when you move? Full
No.
range of motion. Okay. And then I'm also going to assess your knees. Okay, first I'm going to touch and look at both sides. Oh, is that painful for you?
A little bit. Yeah.
Do you normally have any pain in your knees?
Sometimes.
Okay, when did that start?
About 3 years ago.
Was it from working out excessively?
From squatting, yeah, excessively.
Do you hear any clicks or noises in your knees?
Sometimes.
Occasionally? Okay. Let's see. And then I'm going to have you bring your knee up to your chest, your right one. Yep, you're able to. And then back down, and then your left as well. Okay, perfect. And then that you have full range of motion, a little bit of pain, and equal strength in both knees. And then I need you to stand up one more time. You have to come right about here and bend your knee as far back as you can go.
Like this?
Yeah. Okay. And I'll bring it up to the front. Like your knee up if you can.
Oh.
Perfect. Now you can do the other leg. Good. And then bring it up to the front again. Okay. Any pain?
No.
You have equal range of motion there. Okay. And then I'm going to have you turn around, stay standing. And then I'm going to palpate the thoracic and lumbar spine. Spinal processes feel normal. Are you having any pain when I press?
No.
Okay. Good. And then you can stay standing. And then it looks like you have symmetrical shoulders and scapula there. And then your hips are symmetrical on both sides, and your gluteal folds are also symmetrical. I'm going to have you kind of move to your side if you can. And come this way. And I want you to bend and touch your toes. Okay. Any pain?
No.
And then you notice the C curvature when you bend, which is normal. Full range of motion for the back. And then I'm going to have you also from the side. I'm just going to look at your back. We have let me just bend a little bit forward. Perfect. So we have a convex up in the thoracic into a concave curve into the lumbar spine. And then I'm going to have you put your hands on your hips and look at me. And then I want you to bend, if you can, side to side. Okay. Do you feel comfortable?
Yeah.
Is there any pain?
No.
Okay. And then I want you to turn your back and your body without moving your hips. Yep, like that, yep. Same with the other side. Any pain?
No.
Full range of motion there. Looks good. Do you have any questions about anything?
No.
Okay, perfect. Thank you.